In this lecture, we want to talk about general anesthetics. In the previous video, we have looked at local anesthetics. But this video, we want to see drugs which inhibit response or which make loss of response or loss of consciousness in the whole body. So the person here loses consciousness. And this one is done before surgery or before intensive procedure in the hospital to prevent pain. So these painful procedures, we normally give these general anesthetics so that the person loses response and consciousness. So that is what we can talk about general anesthesia. General anesthesia, we are making, it is reversible. This one is reversible. Loss of consciousness. So these anesthetic drugs are given to cause reversible loss of response, which we are calling loss of consciousness, so they become unconscious. You make these people to become unconscious for a given duration of time during this procedure so that they do not feel pain during the procedure. So these are what we call reversible general anesthetics, which cause loss of consciousness of the whole body. And this general anesthesia is divided into 3 stages, and these stages include induction stage, which is this is the time between administration of the anesthetic drug, the time from when you give the drug to the time when the person becomes unconscious. The time when the person becomes unconscious. This is what we call induction stage. So it is the time between when someone is conscious, the time when is conscious after giving or administering the general anesthetic drug. Then maintenance, this is the time or the duration the patient takes when is in unconscious state. So this is maintenance, the period when someone is in unconscious state, and this is the time when you can do your surgery. Then the recovery stage, this is after the anesthetic drug has been withdrawn. So when it is removed, when the anesthetic drug is removed, this is the period it takes for the patient to become conscious after withdrawing this general anesthetic drug. So these are the basically major 3 stages of general anesthesia. So after looking at the stages, now we are going to look at the different general anesthetic drugs which are given during surgery. And we are going to categorize them into, they are divided into 2, whereby one is the ones which are given intravenous, that is IV anesthetics, and the one which are inhaled, this is via lungs. And we are seeing those ones which are given intravenously, they are further categorized into those which are slow acting and fast acting. And the slow acting drugs are given pre-operative, before the operation, because they take long to act. For example, here the drugs we can see are benzodiazepines, and another one is opioids. So these are the major 2 slow-acting anesthetic drugs, whereby benzodiazepines, the most commonly used, we have midazolam. Midazolam is most commonly used, diazepam, and rolazepam. So midazolam, diazepam, and rolazepam are the most commonly used preoperative anesthetic drugs. Why? Because of their slow acting action. They take long to act. That is, they can take between 20 to 30 minutes before they act. That's why we prefer them preoperative. And then the opioids, these are also slow acting and the most commonly used opioids, we're going to see fentanyl. Fentanyl is the one which is most commonly used, slow acting. Fentanyl. And then this fentanyl, we can also synthetically make the acting one like sufentanil and arfentanil. These can also be used, which are derived from fentanyl. So these are the opioids we can use. And in previous videos, we have seen the mechanism of action of benzodiazepam binding to GABA A receptors, leading to opening of chloride ions, hence causing hyperpolarization. Whereas opioids, for them, they also act by blocking influx of calcium ions by binding on the receptors on different receptors, that is the mu, the kappa, and the delta receptors. So these are the slow-acting benzodiazepam, midazolam, diazepam, lorazepam. Then we have seen phenylethyl, sufentanil, and arfentanil also being used as slow-acting, using them preoperatively to induce anesthesia. They are slow-acting and take long, whereas the fast-acting drugs we are going to see, for example, the barbiturates, we have propofol, we have emitol, we have another one called etomidate. Then we have ketamine. So these are the fast-acting general anesthetic drugs which are being used, and their action is always between 30 to 40 seconds. They are faster acting anesthetic drugs, and they take even a little time to maintain the anesthesia. And these ones, they have both analgesic effect and anesthetic effect. And barbiturates, one of the barbiturates used here in this category, we're going to see barbiturate drugs like thiopentol, is used here, and also another one is another type we can use here is methotrexate. These are the drugs used, whereby thiopentol is faster acting, and this one causes major side effect. These guys, all of them, the fast acting are used in induction. They are used in induction and maintenance of anesthesia and the maintenance. So these are their major role. They induce and maintain anesthesia. Whereas etomidate, for it, because of its low effect on cardiac, this is best done in surgery of aneurysm surgery and the cardiac surgery, because of its low action, low side effect on the surgery. But its major effect is it suppresses the adrenal cortex, so it causes adrenal insufficiency. That is etomidate. Propofol, for it, we are going to see in the other side, apart from being used as induction and maintenance, we can also use it in ICU and daycare surgery. Then barbiturates, these ones are widely used, but methotrexate, it can be used for electron you are going to see it can be employed in electroconvulsive therapy. So in electroconvulsive therapy, it can be used because it initiates shivers in the CNS or convulsions. So it is best used in electroconvulsive therapy, whereby then the side effects of these drugs, thiopental and methotrexate, they cause respiratory depression and hypotension. They cause cardiac depression and respiratory depression. These are their major side effects. So we are seeing the barbiturates, which we are using. These barbiturates, which we are calling thiopental and methotrexate, they cause respiratory depression and cardiac depression. And this one results into hypotension. So they have to be monitored. That is their side effects. But we have seen methotrexate doing a great role in treatment of any electroconvulsive therapy. So in electroconvulsive therapy, we can use it due to its effect on the CNS, bring about seizures or what we call convulsions. Then ketamine, which is also part of fast-acting anesthetic IV drugs, we are going to see ketamine for it being faster acting. We shall even see their mechanism of action onwards, but ketamine majorly it binds on MDA receptors, that is N-methyl-D aspartate receptors, of which glutamate receptors, and when it binds in it, it stops influx of calcium ions, hence stopping the cellular activities from happening. And ketamine being an NMDA receptor antagonist, by stopping the action of glutamate, for it is used in this condition known as dissociative anesthetic. It is a dissociative anesthetic. Why it is employed for profound anesthesia. It is used for profound anesthesia. So for profound anesthesia, we are using this one. So it can bring about side effects. It causes amnesia, that is memory loss. It causes hallucinations, vivid dreams. Why we call it dissociative, it dissociates patients from their body and environment. So when taken, you cannot feel anything in your body and you cannot feel anything in the environment. So use it on traumatic surgeries. That is why we are calling it dissociative. And the side effects we have seen hallucinations, vivid dreams, and so forth because of its long-acting. That's why ketamine is being used. Then these barbiturates, their mechanism of action is that they act by binding on GABA-A receptors. So when they bind on GABA-A receptors, the barbiturates, which are faster acting, after binding on GABA-A receptors, they cause opening of chloride ions, leading to influx of chloride ions inside the neuron, causing hyperpolarization. This is the mechanism of action. So they act on GABA-A receptors, causing influx of chloride ions, leading to what we call hyperpolarization, hence stopping the propagation of action potential. Then another drug we have already discussed is etomidate for it, which is safe in people with heart complications. So we are seeing etomidate For it is safe. It has least effects on the heart. So it is used for patients with heart or cardiac complications. But don't forget that also its side effect, it blocks adrenal cortex. It inhibits actions of adrenal cortex. That is its problem. So this is what we can talk about faster acting, whereby we had the barbiturates, we had the ketamine and etomidate, plus propofol, which we saw propofol is used in ICU and daycare surgery. That is what we can remember about propofol. And propofol has its prodrug known as phosphopropofol, which is the prodrug of propofol. Then after looking at IV anesthetics, we can now go to inhalation anesthetics. These ones are taken via lungs. They are inhaled and they are gases. They can be gases and they can be in liquid form. And those in gas form, the major ones which are being used, we have nitric oxide, nitrous oxide, and xenon. But xenon is no longer commonly used because it is expensive to get. So majorly now these days we are using nitrous oxide but nitrous oxide is used in combination with other anesthetic drugs for initiation and maintenance of anesthesia. So these are the gas forms we are being used: nitrous oxide and xenon, but which is no longer being used because of being expensive. Then after looking at the gas, we have also liquids, and the majority of them, they end with a suffix furan. So we are going to see examples like isofuran. We have another example as desfuran, and we have another example as sevofluran. Then together with the cyclopropane and halothane, whereby halothane is also not commonly used, it has been replaced by sevofluran. And we're going to see drugs like, we are looking at liquid, these liquid inhalational drugs, and these liquid inhalational drugs we are seeing isofuran. And this isofuran is so good for people with also cardiac complication because it has least effect. This one has least effect on cardiac, so it can be given people who want to undergo cardiac surgery. And these, they are used for maintaining. They are not used for, this isofuran is not used for inducing, but is used for maintaining anesthesia. Then another type here which we have seen as desfuran. This one is the fastest acting. This is the fastest. Among the liquid anesthetic drugs, this is the fastest acting. It is the fastest inducing agent. It is used for induction of anesthesia. So if they ask in an exam which of the following liquid inhalation anesthetic drugs, the one we can use is desfuran, which is the fastest and is being used in induction and maintenance of anesthesia. Then the last one we can discuss about these liquids, which are, there are many, but these are the ones which are currently being used. So the books will give you ether, they will give you chloroform, but which are no longer being used because of their side effects. Then sevofluran, this one is used in induction of anesthesia in children. It induces anesthesia in pediatric or children, but its ADR, which is seen, it has a ability of causing nephrotoxicity. It causes nephrotoxicity. So it causes renal failure when given in higher doses in children to induce anesthesia. Then cyclopropane, which we saw here, for cyclopropane, which is also a liquid, it is used in hemorrhagic shock. People with hemorrhagic shock, we can use cyclopropane. So this is what we can see in these drugs. So after seeing that, apart from this one being the fastest, its a major side effect it causes irritational cough. This one brings about irritational cough. So that is its major side effect. So this is what we can discuss about inhalational liquid anesthetics, which we have seen isoflurane, which has least effect on cardiac, hence being used for cardiac surgery and daycare surgery. Then desflurane being the fastest in inducing anesthesia, but its major side effect is irritational cough by causing bronchospasm. Then sevoflurane, it is used in inducing anesthesia in children, but the side effect, major one, is nephrotoxicity. Then we have seen cyclopropane being used in hemorrhagic shock. That is what we can discuss under the inhalational liquid anesthetic drugs. Then there is another type of drug which we put here, but is not being seen, which is an alpha-2 agonist called dexmedetomidine. So this drug, which is an alpha-2 agonist, it acts by blocking. For it blocks the alpha-2, which is presynaptic, hence not allowing release of norepinephrine. So this drug is also being employed and is being used in also anesthesia. Then lastly, about the drugs we can discuss in this session is muscle relaxants. And these muscle relaxants, they can also be used to cause immobility. And these muscle relaxants, they include succinylcholine, but which is short-acting. So the commonly used one is rocuronium and veturonium. So rocuronium and veturonium are non-depolarizing muscle relaxants. You can call them non-depolarizing muscle relaxants, which their mechanism of action or their mode of action, is that they come and block the nicotinic muscular receptors on the sarcolemma, that is at the neuromuscular junction. And after blocking the nicotinic muscular receptors where acetylcholine functions, when they block them, they do not allow propagation of action potential, hence causing muscle relaxation, which is different from others. Maybe one thing I have not talked about as I conclude is also liquids. These liquid inhalation, they act on the potassium gated channels with two domains. And when they act on these potassium channels, they cause this one to open, leading to efflux of potassium ions. And when we lose more potassium ions out, the inside becomes more negative, leading to hyperpolarization of excitatory neuron. So this gas and liquid inhalation anesthetics, they act by binding on two-domain potassium-gated channel, which causes efflux of potassium leading to hyperpolarization, bring about inhibitory effect. That is their mechanism of action. So it is always important to know the mechanism of action of each drug, whereby these ones we have seen barbiturates and etomidate working on GABA-A, ketamine on MDA receptors. Then we have seen these inhalational acting either on potassium or on NMDA receptor, blocking the influx of calcium ions by blocking the action of glutamate on the NMDA receptors. So thank you so much for learning with us from beginning until the end. Hope you have benefited, where we have looked at different classes of anesthetic drugs. Don't forget those which are IV, and under IV we have seen slow acting, and under slow acting we have benzodiazepines and opioids. Then the fast acting we had the barbiturates, that is the thiopental and the methotrexate. Then we saw also ketamine and propofol. Then under inhalational, we have seen gas and those which are liquid, and those which are under gas, we have seen xenon, which is not commonly used because of being expensive, and nitrous oxide. Then we have finished by looking at liquids, which we have seen, we have elucidated more here, and then we ended by looking at muscle relaxants, which can also be employed in anesthesia. Thank you so much. May good Lord bless you.